Hey everyone, we are Britt and Drea from motherhoodalliance.com, and we are excited to welcome you to a 4-episode series with Dr. Mitch Sutton, a chiropractor and the founder of Reclaim Health. Dr. Mitch is a powerhouse of knowledge. You're going to learn that in these 4 episodes, as he specializes in not only the nervous system, but also immune dysfunction, barrier permeability, which is the gut and the brain-blood barrier connection, mold toxicity, eczema, allergies, asthma, autoimmune, and neurodegenerative disorders. Using advanced testing and targeted support, Dr. Mitch helps patients truly connect the dots of their health in order to understand how their body is actually functioning so they can stop guessing and they can actually start healing. And when he's not helping patients reclaim their health, he is a husband and a dad of 2 girls. We are really excited to introduce him to you now. Hey everyone, welcome back to episode number 3 with Dr. Mitch. Welcome back, Dr. Mitch.
Yeah, I'm excited. Let's do
I
it.
know. Look at you. We're just so excited. So if you guys are just listening on Spotify or on Apple and you don't have the video, maybe you should just pop it up, because I think it is really helpful, honestly, just to see like the way that when you're talking about different areas, just using your hands on like pointing different things. So
I know,
we did
my
not
wife
break
always
out the
makes
whiteboard
fun of me because I'm a hand talker,
you're a
but
hand
like
guy.
I think it helps. It works.
Well, in this episode, we're going to be talking about neurodegenerative diseases. But I will say very strongly, if you are popping into this episode right now because the title caught your attention, hit pause and go back to episode number 1 and go through this series in order, because we're going to be referencing things that we've already been talking about in prior episodes. And Dr. Mitch is a deep, deep wealth of knowledge, and you're going to want to make sure you have that background information heading into this episode. So, but with this one specifically, let's just kind of give a 10,000 foot view of what we're talking about. What is a neurodegenerative disease? What is happening with it? And then can you give us some examples of specific ones? What are we talking about?
Yeah. So basically at the end of the day is that there is some sort of damage that's happening to your brain, right? To the cells, to the neurons, to different, pieces of the brain that's not working in the correct way. Its ability to perform normally does not work anymore. If we're talking Parkinson's, that has to do with your dopamine production that's in the substantia nigra in the brain. If we're talking Alzheimer's, that more has to do with, that's a big insulin issue. That's a big insulin resistance problem, that the cell cannot get energy, like ATP, like how it makes stuff work correctly or effectively, which then screws up the mitochondrial function inside the cell. MS, right? MS is a different one because it's an autoimmune issue, right? But it's still where that immune system destruction is happening inside the brain. Those are kind of a lot of the main ones that you usually see of. It's more so, okay, what's creating damage in the brain and why is it not working?
Yeah. So, okay, just kind of starting high level, how I envision this episode going is we're going to talk about how this is kind of a slow decline a lot of times for people. And so people start out, they're young, they're healthy, they have normal brain function happening, right? So I think my first question, especially because a lot of our listeners are moms and they have felt like they've experienced something like pregnancy brain, or really no matter what your age, a lot of people are just like, oh, I have brain fog, or where did I put my car keys? Just those really tiny memory loss things. You go downstairs, you go upstairs to grab something, and you get up there and you're like, what in the world did I just come up here for? I can't remember. Or just focusing issues. Are these signs that are like red flags? Are these normal?
I mean, there's some of those things that are life, whatever, especially moms. You got a million things going on, right? You're not getting sleep. You're not giving your body the things of what you need to because you're taking care of everybody else. And just like lack of some of those resources or where some of that stuff comes from. Now, the stress piece of this is important because there's an adrenal hormone. It's called DHEA. Okay. Don't go taking DHEA. Don't, please. Because if you take DHEA, and that can specifically drive more, it's the building block to your testosterones and your estrogens. And so if you just add more fuel to the fire, if there's some sort of hormonal dysfunction, you're going to feel worse. So you got to make sure that you know what's going on when you do some of these things. But DHEA, adrenal hormone, yes, but technically it's a neural steroid, right? It actually works on the connectivity of the communication between the neurons in your brain. So sometimes when I ask people, it's like, okay, right? Like you walk inside of a room and you're like, why did I walk into this room? or, the word is just on the tip of your tongue. Like, that it's in there, but when you reach back, it's just like, where did it go? There's some of those pieces that are a little bit more of like the hormonal dysfunction piece. And then circling back around to sleep. Sleep is how your brain like detoxifies itself. We're bombarded by a lot of, it's Bluetooth and it's Wi-Fi and it's 5G and there's a lot of electromagnetic frequency stuff that's going to create dysfunction inside the brain. And even just being awake technically creates low levels of irritation inside your brain. But when you sleep, that technically what happens is that you have something called cerebral spinal fluid that is from your sacrum all the way up to your brain. And walking is what pumps that cerebral spinal fluid. Okay. It's this undulation process. And when you sleep, that cerebral spinal fluid actually like pools up in your brain and it has a lot of antioxidant stuff in there. So it like scrubs all of the junk that happened into your brain. And basically you wake up and you're like, oh, okay, I feel better, right? Because you've gotten rid of some of that inflammatory response inside your brain. So like, honestly, truly, like sleep is a very, very, very lifelong thing that is important if you're talking about any type of degenerative brain issue. Some people sleep great. Some people struggle for them, right? This is the melatonin conversation, but more so like female physiology has a lot to do with your progesterone. Why that's important is because progesterone releases this very soothing, calming brain hormone called GABA. Because I always ask, right, do you have difficulty falling asleep or do you have difficulty staying asleep? Because those are two completely different things. GABA is what makes you stay asleep. And it's also that very soothing, calming, inhibitory brain hormone, right? Because your brain's either excitatory or inhibitory. And so if you don't have the calming, inhibitory side of things, then that's also technically then in a cyclic woman, when it's that week before cycle where progesterone and estrogen should balance each other out. But if that progesterone's low, then it's like, okay, do you have a little bit more of a short fuse? You're a little bit more irritable. Also, do you have difficulty staying asleep? That's always a big thing. That's like, oh, okay. Is this more a hormonal piece or is it truly GABA production? Because that has to do with your gut bacteria. That's where a lot of that stuff is made. So there's those pieces that are important. And even to sometimes the restlessness at night, people kind of toss and turn. GABA is also what paralyzes you. So if you're running in your dreams, you don't want to be running in bed, kind of a thing. So that's what makes your body stay asleep, which is important, and having the normal balance. Because a lot of degenerative brain issues are they call it excitatory toxicity. Okay. There's too much excitatory brain hormone signal that is creating a lot of dysfunction. And there's this excitatory toxicity that inhibits. There's these specific, they're called macrophages, but part of white blood cell in your brain, it's called a microglial cell. And a microglial cell is also what cleans up and gets rid of toxins, infectious agents, and things of that nature. And so if you have a lot of excitatory stimulus for a long period of time, then that's also going to inhibit your body's ability to clear out stuff that can cross over in the blood-brain barrier that gets infections that come in through there, which then that's where you're going to see then the chronic inflammatory response of a low level infection just continue to create destruction inside of whatever brain tissue that it is.
So in our last episode, we talked about autoimmunity. Is this all stemming kind of from, is it all stemming from basically what we've been talking about? Are these brain degenerative disorders kind of autoimmune disorders that are built over time?
I mean, in saying that, it's still the same presentation of how immune system shows up, right? There's going to be a Th2 dominance, Th1 inhibition. Now, depending on what type of irritant, and this is too, like your blood-brain barrier, right, is what helps keep stuff from circulating through your bloodstream from crossing over into your brain. Now, that is the same barrier that is your intestinal barrier. Okay, again, body's complex, but not complicated. So again, if there's any gut barrier dysfunction, then also looking at, okay, where is there some sort of blood-brain barrier dysfunction? Which there are other tests that you can show that specifically show, okay, 100% it's a blood-brain barrier issue. and you need to put that back together. But then there's this whole, like, the term cross-reactivity, which is part of the autoimmune response. Now, touching on that a little bit, is that there are certain infectious agents that look molecularly similar to some of your body's own tissue. 70, 80% similar. And so as a protective response, your body's going to say, oh, we have this infectious agent. This thing looks kind of similar to it. We're just going to attack that just to protect ourselves. But it's your body's own tissue. MS, a lot of times it's Epstein-Barr, which now this is also a neat thing. Not all the time is it that. Okay. And I ask people too, when they come in and they do an MRI, right? And you see lesions that happen in the body, because the lesion just shows like, okay, this is where the sclerosis, the damage that's happening inside the brain, and which part's happening. Certain infectious agents have a high affinity for certain parts of the brain. So Epstein-Barr likes to sit inside the brainstem. Okay. And so if you see a lesion that's on an MRI and you see that in the brainstem, then that's where we're going to go and like, okay, we're going to test that and make sure that that's what it is. And then that's where we're going to go and start resolving those issues. Parkinson's is destruction of something called a substantia nigra, which is where your dopamine production comes from. Now, there's a strep infection that likes to sit right inside that area that is going to create destruction to that tissue, which then continues to degenerate that substantia nigra and the inability of your body to produce dopamine. And then just the progression just continues to happen.
So that's creating an environment that's conducive for Parkinson's, or that is a cause of Parkinson's?
That is a cause.
Okay. Huh.
Yeah. Now, there's again, the inability to clear out that infection. Right? Because if we circle back, what other damage, excitatory toxicity that's happening in the brain that's not allowing those immune microglial cells to do the job to clear that stuff out? So like, yes, this is the infectious agent. This is the thing that we got to deal with. But how we deal with it is making sure that immune system has the ability to actually get that stuff out.
So, just kind of looking at this from a high level, a lot of people look at Alzheimer's, for example, or even Parkinson's as highly genetic and a death sentence, basically. So going back to the genetics piece, we had that conversation in the last episode. I'm assuming what you talked about there holds true to these diseases as well?
Correct. There's still, what is that environment and why are certain genetic responses being triggered based on what we're doing to the body or what we may not be receiving. There's this other neat thing that happens. Homeostasis, right? Like that's balance. That's how your body is supposed to work. Okay. Too much, not good. Too little, not good. Now, a lot of times people sit in like, what's creating the issue? What is the outside stimulus here that's creating that inflammatory dysfunction? Equally, if you are just deficient in certain resources in the body, that I'll say symptom or the presentation of that damage and inflammation show up equally. So it may not be this infectious outside environmental thing. You may just be deficient in certain things that are going to show up the exact same way inside the body, which is why when certain tests come back and like, oh, everything is normal, because you're missing the other side of the coin that, yes, this is normal because there's nothing outside that's going to create a change to that. It's just, you just don't have the things to heal. If you just start giving people some resources to heal their body because their body's been starving for it, you see quick turnaround. You're going to see an immediate response. Oh my God, my body's been starving for this. And now it works in the way that it is because it has the fuel that's needed, and you start to see those issues resolve.
Okay, so let's talk about two different types of people here. People who just want to have good prevention. What are some prevention tips for good brain health? And you talked about how Alzheimer's is highly related to glucose and insulin resistance. And so that I've never heard before. So, okay, let's talk about prevention first. And then I want to talk about for people who maybe have a loved one has a diagnosis already? What are things that they can be doing? So starting with
Yeah.
prevention, what can we do for good
Okay.
brain health?
Sleep is important. Honestly, sleep is what you need. Now, I take turmeric every day. Yes, super anti-inflammatory, but also that has this other compound. It's called turmerone in it that stimulates glutathione production. So, especially when you sleep and getting the antioxidant piece, that's gonna help clean and scrub your brain from some of that stuff. That's gonna help make sure that that damage doesn't persist, so to speak. Fat is important, like consuming fat, consuming saturated fats, because your brain is made of fat. And so if you are not consuming the resources that your body needs in order to produce the appropriate tissue, like you're also deficient and it's going to start to degenerate. I mean, then you kind of touch on the whole blood sugar side of things too, because this is actually super neat to see. So there's a lot of talk, right, that Alzheimer's, dementia is like they're calling it type 3 diabetes, because if you have an insulin resistance to your system, okay, basically meaning that you need more insulin in order to drive fuel inside a cell for the cell to work appropriately. So when you take the insulin out of the question, or I'll say out of the picture, okay, when your body is using a fat as an energy or fat as a resource so there's this cognitive test that, it's the classic analog clock. You draw the circle, put the numbers in the order of where they need to be. And a lot of degenerative brain, I'll say, people have failed that test. That's a cognitive function test. And just by taking, I think it was like a few tablespoons of coconut oil, which is just full on fat, saturated fat, within like a couple hours, they were able to do that test normally.
What?
So,
whoa.
Yeah, like in that piece, right? It's making sure you keep your blood glucose, but more importantly, that you keep your insulin in check and you keep it sensitive. You keep it working in the appropriate way so that your body can use the resources and not create issues. So the more insulin resistance to the system, the more dysfunction that you're going to have. And that's history, like insulin resistant type issues that show up before degenerative brain issues do. That's high blood pressure. Okay. That's obviously type 2 diabetes. That's technically a big part of what PCOS is, polycystic ovarian syndrome. Because insulin inhibits the conversion of your testosterone to estrogen, which then you can't release the follicle. So keeping your sugars in check is an incredibly important thing. And making sure cognitively that your brain is not going to be constantly bombarded by stuff, and sleep are your major factors that are going to be long-term beneficial things to keep your brain working great.
Do you have, as you're talking, I'm just thinking about Drea, I know you've read a few books on insulin resistance as well. And do you have any resources, Dr. Mitch, books that you would recommend or websites that you would recommend people check out that would help them feel more educated in any of those topics that you were just talking about?
Yeah, there's a metabolic scientist out of BYU, purely academic. His name's Dr. Ben Bickman. He has a book out. It's called Why We Get Sick. And he studies fat cells in his lab. And that's all that he talks about, and understanding how insulin creates problems. And he does a great job of just keeping it simple and understanding what to do and other strategies around it.
That's a great.
We'll link to that in the
show
notes.
I read that book. Excellent. Yeah.
Yeah.
I agree.
And this is even just not even changing the amount of calories that you eat in a day, just changing the time of when you eat those calories.
Yes.
Okay?
Yeah.
So if you have your big meal at the end of the day, okay, in comparison, if breakfast is the smallest, lunch medium, and dinner is the highest, in the reverse, if breakfast is the highest calorie and then dinner is your lowest, the next day they test insulin levels, and dinner with the higher calorie meal, the next day insulin levels are 2.5 times higher than dinner at the lowest calorie. So shifting those pieces and again, helping people understand, you don't really have to change what you're eating. You just have when you're eating it is just another important piece to kind of help people come through and be like, yeah, this is why.
And as you're talking, even in the last episode, we touched on it just a little bit, but as you were just talking about prevention, and last episode you talked about whole foods, this episode you're talking about like that piece, but also just controlling your blood sugar and choosing wisely in your food. This is where lifelong eating really does matter, right? And everything we're doing now is setting us up for how we're going to feel in the future.
Yeah.
And so it's so hard when you're like in your 20s, obviously. Well, you haven't grown your brain all the way yet anyway to make good choices.
Scientific fact.
But even just thinking about now, like I'm in my mid to upper-ish 30s, it's like society has such a pull on us for what we want to consume and what's tasty to us. And it's just like, I'm just going to have this cheeseburger that day and this pizza that day. And then, if you're in a break room, talk about company break rooms, and they have brownies and donuts all the time. And it's like, well, one won't hurt. But when this is happening often and people are not really paying attention to how much sugar they're consuming, how carbs are in everything, like people don't even have any idea how much sugar they are consuming. This really does matter lifelong.
Very much, right? And this is too, like, I love food. I love it. Okay. And there's a part of eating well does not mean that it tastes terrible. And there's a part that happens with this. And again, this is more so, it's the educational piece. Because if you understand and know why, like if you burn your hand on the stove and it hurts, hey, guess what? You're not going to do that again. There's the same piece of, hey, this is what this is actually doing to your body. And this is how it's creating these problems. And even I ask people, hey, let's cut out carbs. Let's cut out sugar stuff. And I kind of I had this inkling, right? And I was like, well, what does sugar actually mean to you? Oh, it's your candies and your donuts and your sweets and those kind of things. Yeah, that's part of it. But it's also like, okay, what's your pasta? What's your grain intake? What's your starchy vegetables, right? Like even what's your fruit consumption, your beverage piece of it. If you also show people, hey, this is actually all that sugar is too, you could see the light bulb go off and they're like, oh my God, I have been doing this wrong. There you go. Take this information and go fly. There's the part of helping people go through some of that stuff too. Now, then there's this other neat piece of this. Okay. So how your body actually builds the reward system, how you actually build dopamine is not in completing your task. It's in the process of going through the task. So there can be this entire neurological shift. If you're eating the foods that that are helping your body, then also technically you kind of start to stimulate more dopamine to those foods that are healthier for you, which then you enjoy them more. It's this process of this is the information, this is why, and then going through that process, you start to build more of that motivation and determination in order to, again, like this is why it feels good to feel good. And it feels good to eat these foods that I know that are good for my body.
Yeah.
And I'm sure you guys have all done this too. When you go out and you do something and the next day, I probably shouldn't have had that because something hurts or tummy or like you got a breakout somewhere. My joints hurt afterwards if I do something stupid. But those are kind of those friendly reminders that I actually very much enjoy that people do because it's like, stop touching the stove. Stop hitting your hand because this is what it does to you. And when you start to heal, technically you're going to have more of a reaction to some of the things that are bad for you, which is a positive thing because it kind of helps you keep you in line.
All right. Well, let's make sure that we have some time for those who are already experiencing some brain degeneration. What can they do? Can they reverse it fully? If somebody gets diagnosed with Alzheimer's, is it fully reversible or can you just keep symptoms at bay? Walk us through this.
I mean, okay. So whenever I have somebody that comes in with because those are no joke, those are severe issues. I always say we need to stop the progression from happening. Okay. That's first and foremost. Let's stop this chronic damage of what's creating the issue so that progression doesn't continue to happen. Now, And again, on where somebody is, the time, the resources, how long that it's been. You've had lesions resolve on MRIs. You've had the normal cognitive function come back. And now there's part of this that kind of broke that system a little bit. So like you got to keep on top of your stuff to just continue to make sure that you stay on top of your game, because that's where you're really going to see a lot of normal daily function and cognitive function actually sustain, is if you're able to continue to keep up and do the right things. There's some people that resolve, there's some people that we haven't quite gotten there yet. I'm never going to promise the world here when you go through and you see some of these things, but have you seen some pretty cool stuff happen and resolution of some of those things? Yeah, it's neat.
And maybe a different way to rephrase that is, if someone has a family member suffering right now, what should they start doing right away?
Honestly, start cutting out sugar stuff. Like, I know that that's easier said than done, but that is going to substantially change outcome.
What about, something you haven't talked about yet in even the prevention side is, how much does exercise play a role in brain health? And then what about fish oil supplements? Because those are always talked about for brain health.
Honestly, actually, exercise it's funny, right? There's this joke of, actual physical activity and working out your muscles is actually what helps increase your cognitive function. So there's this whole like, oh yeah, you want to be this big macho guy, but guess what? You're also helping your brain so that it works better too. Exercise is a significant piece in making sure that neurological stimulation happens. Fish oil is great. Okay, there's your EPA and then there's your DHA. Now, those technically are in the category of something called resolvins, which that's the piece immune system wise that helps your body to heal and resolve the inflammation that's inside the system. And so getting that tissue working normally again with a solid fish oil is also just going to help the tissue work appropriately. So is there a part that's very much helpful for your brain? Yes, but it's helpful for your brain because you're directly affecting the immune response that is affecting the brain tissue. And my main like staples for people: make sure your vitamin D's level's good. Make sure you do something to keep stomach acidity working. You do a methylated B vitamin because, again, we just don't have those resources. You do a solid fish oil, and if you do probiotic, great. If you do some solid fermented food, that works too. And also make sure you keep up with your salts, your good salt, okay? Because just the mineral deficiency piece is part of that too. So those are kind of your basic stuff. That's like everybody should kind of just do those.
And then sleep and exercise, of course.
And sleep and exercise.
That's
Movement.
Yeah.
Okay.
Love it.
What about brain games? Are those effective at keeping our brain healthy? People doing Sudokus, crossword puzzles, like brain stimulate things. You think about as people get older, it's like start doing these things that make your brain think. Does that have any effect on these types of neurodegenerative diseases?
Not really.
Okay.
No,
still do them though. I mean,
fair. That's fair. You still need some mental stimulation. Yes. There's a book. I can't remember who the author is. It was called Neuroimmunity, which again, more so has to do with how immune system is functioning and able to clean up the damaged tissue that happens inside the brain. That is more so the focus when you're dealing with neurodegenerative issues.
Okay. We'll find the author. We'll link to that in the show notes too for anyone who wants to check it out. Okay, one last question. Since you are a chiropractor, how much does chiropractic play like in brain health? Because obviously you're adjusting to make sure that everything is in alignment and the nervous system is firing well. What does that have to do with brain health?
So one of my Parkinson's patients, doing the lab work, doing the supplementation, working on this piece, helping immune system, all that kind of stuff. But she comes in and I see her and I adjust her every couple weeks. And the before and after is just, it's significant, right? Like it makes me giggle. Okay. Like, yes, you went to school and you do all these things, but there's still parts where you just are amazed at like, this works, right? Like, this is such a cool thing. right? But like her movement and her rigidity and all of those things significantly improve from when she walks in the doors and when she walks out. And that has more so to do with a lot of the trauma aspect of things in the nervous system. It's your fight or flight, sympathetic, parasympathetic. Okay. And parasympathetic response, you're also trying to increase your vagal tone. You're making sure vagus nerve is also working in the appropriate fashion, because autonomic nervous system, you're one or the other. You're either stressed, sympathetic, inflammatory dysfunction, or you're parasympathetic, the calm, rest, digest, the healing aspect of things. So in the adjusting side of things, technically what you're doing is you're also just helping to promote the parasympathetic side of things and the healing process.
Okay. So cool. So interesting. Thank you so much for sharing your knowledge in all 3 of these episodes so far. Our next episode, we're going to be talking more about mold. So I feel like this is a little bit of a shift in our conversation so far, because so far it's been a lot of internal things and things that we can control through supplements and all that. Mold is going to be more of an external piece coming in to us and seeing how that affects us. So this is going to be a really good conversation. Stay tuned, you guys. We got one more great one coming up with Dr. Mitch.
If you enjoyed this episode, would you consider leaving a rating or review or sharing it directly with a friend who could benefit from the information? We know that you're a busy mom or caregiver, and our goal is to make your life easier by bringing tips and tricks directly from experts into your earbuds. By sharing this episode with someone you love, you can play a critical role in helping to make their life easier as well. We appreciate your time, and thank you for being a part of the Motherhood Alliance family.